went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma
It's a stabbing, cordra.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
It's horrid. I don't like Red Nose Day.
But it's just another day.
I just find it all just a load of famous people crying in Africa, trying to get their profile up.
Really famous people. All like this
Okay,
to
I
me. It's not
saw,
Red Nose.
what's that little group? Boy band.
Boyzone.
No, young. 70, Harry.
He's
my age.
17.
You're, no. You're going back like 30 years, darling. What's their names?
Steps. Are they
No.
boy band?
Yeah, One Direction. But see, someone knows. One Direction. They were in Africa crying.
They were One Direction.
If you go into Sainsbury's, they're now on a birthday cake.
I've heard of Westlife. You raise me up.
Anyway, them. There you go.
You think I call you in because there's no one here.
No, I know.
It was empty when I come in here.
Yeah.
It's so nice and straight. Legs 11.
It's not that short, your skirt now, don't worry.
I don't know, Nan. As far as I can feel, I mean, she's asleep, but I still don't think the nappy she's got on now is wet.
2-year-old Sydney hasn't passed urine for 2 days. Parents Keely and Michael have brought her to King's.
That's still not right. As an adult, I can't hold my toilet for that long, and my bladder's trained. All right? All right then, Nan. All right, bye.
I was worried just that if she's not going away, why is she not going away? It's not normal.
What's he doing? What's he doing to you?
When I first met Michael, I was about 13 and a half, maybe 14. We met through friends, just generally hanging out.
I found her on Facebook. I messaged her. I didn't think I would get a reply. But then when I saw a reply, I thought to myself, I smiled that obviously that Keely replied. So then we started talking from there and met up.
Shake your foot. Shake it.
Keely was loving. She was always there when I needed someone to talk to. And we've never looked back, really.
Michael.
We have 4 kids. Chelsea, she's 13. We have Chanel, she's 6. Caden, he's 4. And we have Sydney, and she's 2.
Hello? Because I told you have to go to Nan's. No, you can't. And I said take your ass to Nan's, and if I have to tell you again, you're going to be in trouble.
Just after my 15th birthday, I fell poorly and I was at my nan's house and she called an ambulance and they took me to King's College with a suspected kidney infection. I was in A&E and they took me upstairs to do a kidney scan and the midwife looked at my mum and said she's having a baby, and Chelsea was born 37 minutes later. Yes.
Did you have any idea?
No, I went to school 2 days before I had Chelsea and did trampolining and played football on the teams at school. So when my mum phoned the school and said, Keely can't come to school today, she's had a baby, my head of year said, are you being for real? She was on my trampoline 2 days ago. And my mum said, yeah, she had a baby. Don't you dare put the phone down on me when I'm speaking to you, do you understand me? She's 13 now. Big pain in the backside. No, don't okay me like you're not listening. Do you understand me? Right, hurry up, she's waiting for you. Stop saying bye. It's not your place to say bye.
Hello, King's A&E. Yep. Do we know how far? Okay. Yep. 8 minutes. And they want this as the major trauma? Yep, okay. All right, thanks. Bye. Bye.
How long? 8 minutes? Should I say 5?
Yeah.
Adult trauma call, A&E resus, ETA 5 minutes. That's adult trauma call, A&E resus, ETA 5 minutes.
A 33-year-old man is being rushed to King's with knife wounds.
Two stabs.
Father of one, Dilson, was stabbed in the head and neck as he was leaving a nightclub in the early hours of the morning.
Well, they're not really.
Mr. Dilson normally fit him well, involved in an altercation today, this morning, 2 isolated injuries to the head.
Let us hand over,
To
sweetheart.
the back of the head with apparently a butcher knife. The larger injuries to the back of the
Sweetheart,
head.
just let us hand over.
Obs-wise, he's been stable, slightly tacky, 110.
Okay.
The wound to the back of his head is about 3 centimetres long. It's quite deep. It's into the body of the trapezius.
As a trauma centre, King's gets quite a number of stabbings. The ambulance service will prioritise bringing stabbings here over somewhere else if they think it's serious enough, because the whole idea of being a trauma centre here at King's is that we have the specialties here in one place to deal with those types of injuries.
That's it. So, another one there? Or is that just, yeah, bleach. Back that up.
Yeah,
I think he's had another one there, isn't there?
got another small one there, probably, yeah.
And then, just have a look at this one.
I think one of the things about stab wounds is until you've assessed them, you don't know how deep the stab wounds are. Until you've looked at them completely over, you don't know if there are any other stab wounds that the ambulance crew might not have seen.
Is this stabbing? But that's just the doctor's hand, okay?
I don't even know what happened to me, because what I tried to do, I tried to stop the fight, then what I did, I was bleeding just coming out my head. I didn't know what happened.
Less than 1 centimetre right triceps.
Well, you're in the right place now, yeah? Don't worry, my love, it's okay. Come on, take some nice deep breaths.
If you sit back, like there.
Sometimes stabbings and gunshots are the most difficult to deal with because they're so pent up when they come in.
I don't need that, man.
We're going to get you.
Give me that, but I don't need it, man.
Their mind is still back where they were assaulted. Then they have one person putting a cannula in, one person assessing them, one person touching their tummy, one person putting a monitor on. And it just puts people into a spin.
I don't know who the guy is, because what I was trying to do, I was trying to stop the fight, because...
Sweetheart, it's okay.
At the end of the day, because I'm a Christian guy.
Lift your hand up.
Put some pressure on here to stop the bleeding.
Some stab wounds can be fatal, particularly if you imagine around the neck. If you manage to stab through one of the blood vessels in your neck and it stops you getting oxygen to your brain, then that can have fairly serious consequences. You can puncture a lung. That can be potentially life-threatening as well. I've got a a young 33-year-old chap. He's got a nasty, deeper wound into the belly of his right trapezius on the posteriorly on his neck, which we can't see how deep it is. Well, he's a little bit hysterical, but we're thinking he'll lie still for a scan. But he wants to CT head and neck. Cheers, mate. Thank you very much, mate.
God.
I think that's what he had before that came off.
No, it's some gang with nothing, man. I just did the...
No one said you were, sweetheart. Oh, hey?
You've had a few drinkies, haven't you?
I didn't have... Don't say that. I stopped saying that. Okay. I have a few drinks, fair enough, yeah, but I know what I'm doing.
Okay.
What I did, I've been stopped and you don't thinking like I'm some...
Sesame. There is a border of people being hysterical, and then there's a border of people being hysterical with the possibility of becoming violent.
I'm not shouting. I'm not shouting. I'm not shouting.
We just need... You do need...
I'm not... This is how you shout.
You just need to calm it down, though, sweetheart. There's always a very thin line to tread, and you don't know if a fight has been caused by them for being aggressive. So it's very difficult to kind of put your boundaries there and say, this is who we are, this is what we're trying to do, we're trying to make you safe, you just need to trust us.
Do something to me, because I got a daughter that is 12 years old. Do you know what I mean? I need to look after my daughter. What's going to happen if I die?
It's been 25 minutes since Dilson was brought into King's with a deep knife wound to his neck.
You don't know talking sense. You don't know talking rubbish. You understand?
Doctors must keep Dilson calm in order to fully assess his injuries.
I don't want to even answer no question because you're pissing me off.
He just needs to chill out. Have we got his morphine? After a smidge of morphine, it'll help his pain, it'll be a lot better. And also, if the stiller you stay, the less your neck will hurt. I think if a patient's hysterical when they come in, it's really important to calm them down, certainly from our point of view in terms of assessing them, getting their pain under control, for example. It can often help with that.
I'm losing a lot of blood. I'd rather die, man. You know what it is, yeah? My head is hurting me, and my eyes is hurting me. I can't function. I was really scared, to be honest. Really scared. It was in a bad state of mind. I was really worried as well.
All right, love.
Thank you.
I'm gonna get you some painkillers, okay, sweetheart?
I'm really sorry about whatever happened, so I want to calm down.
It's not your fault, is it?
Yeah?
It's not your fault, hey?
Do you know when you're trying to save somebody's life? A lot of emotional stuff was getting to my head. Do you know what I mean? Because when you're in that situation, you start thinking a lot of things. Because you've never been to that stabbing experience. Do you know what I mean? Because I can't believe this happened to me because I'm not ready to come on.
Don't worry, sweetheart. Sweetheart, look at me. Here, close your eyes. Let me get that too.
I grew up in London. I was a quiet kid till about I was 21. That's when I started coming out of myself. You know what I mean? So I just used to be at home, doing my work, never been in trouble with no one.
We'll drip in your arm, okay? So we can give you some...
I'm even scared because I don't know what's going on because it's my first time I've been like that.
Calm down, hey?
My mom passed away in a car accident. I was about 5 years old. I was really young. It don't make no sense. But as always, the good people have to go. You know what I mean? So, I grew up with my grandmother. She made me to be the man who I am today, so I really appreciate that. Yeah, I'm gonna hold it, don't worry. Thank you very much for your doctors, even the paramedic that coming to pick me up. Thank you very much. I want to see, when I feel better, I want to see all of these. Just to say thank you, because I really appreciate it.
I think it is quite nice when people have calmed down because all of a sudden you see actually the real person. Chick, Chick, CT are ready, okay?
Be looking after me very well, even though I'm a bit whingy.
If they trust you enough to have a bit of banter with you, then I think you've done your job. Come on, let's go.
I have to come and see you, man.
Yeah, you will.
Now that Dilson is less agitated, he's being sent for a CT scan. This will show whether he's sustained any serious internal injuries.
One of the issues with trauma is that the situation can change. You continually reassess the patient, so until you're happy with one area, you don't move on to the next. I think the hard thing to tell is, even if you look at a wound and say, oh, it looks quite deep, is which direction is it going in?
I can't believe I got stabbed.
I know, it's annoying.
On my head.
It's okay.
Fucking hell, that's
hang on.
Oh, too far.
Too far?
Go forward.
So go this way.
No, lie back.
Down.
I need to wee as well.
Okay, it'll be 2 minutes.
I remember the day when I used to go clubbing, never used to be a knife. If anybody step in anybody's shoes, she used to say sorry and that's it. But nowadays, now you step in somebody's shoes, you get a knife or you get a gun in your head. See what I mean? Just times have changed, really. That's why I'm really scared about my daughter.
All right.
Stay still for us.
I got a daughter, her name's Tegan, she's 12. I love her so much, she's my life. She means the world to me. I'll do what I can do to protect her, but it's just little kids, they're trying to prove themselves. They want to be gangsters. And what they're trying to prove a point, what, killing other people's life, what they're gonna prove. Do you know what I mean? They don't value life, they don't care about other people's life. But I value life, I care about other people's life. Do you know what I mean? They don't care.
I think we might have broken your bum falling on it. We'll have to get one of them scooter things soon now, won't we?
One of them
scooter things, but they...
You know, Mary's daughter, Carol, her mother-in-law, she drives one. She's nearly as old as me.
Really?
Yeah.
Oh, she gets about then.
So does that lady, Paul's mum, isn't it?
Yeah, June, she goes everywhere.
She drives one, doesn't she?
I see her. I see her at Lewisham, she's over the West End. You know, she'll charge her battery up and you'll see her going over Waterloo Bridge to go shopping now, up the West End. Yeah, scare the life out of me on one of them.
What's the matter? You look really flustered.
I was 13 when I became a dad, and I was really shocked. One day, obviously, my mum went out. Me and my brother was watching TV. You saw the dramas, having sex, and we started laughing about it. Ain't that funny that two people having sex, kissing? So I thought, okay, let me try it and see what happens. And then we did. I was scared. So I was like, I closed my eyes and I kissed her, and she said to me, you know. But after that, we started kissing all the time. I was actually at school and I got a message on my phone because my mum bought me credit in the morning. So I phoned her and she said to me, oh, guess what? So I said to Keely, well, what's the matter? She goes, I just had a baby. And I paused for like 5 seconds. And then I was happy after that. I said to her, I'll come and see you later. And then that's why I went to go see her.
I'll eat that bit. You want a bit?
Everybody thought Michael would be gone after 6 weeks or a few months, but he's still here, still going strong.
Any regrets?
No, I'll never regret it. I'll do anything for my children. I'll love them even more every day. The more children we had is the more love we had.
39-year-old woman with a red nose on. Going,
I missed it at school today.
Oh, it's a rabbit. Oh, I want to play with the rabbit.
Come on, let's put it on the arm.
Why would you put it on my arm? That's exactly a happy arm.
Hello, Dorene. How do you normally get around indoors? You use a stick or anything indoors? Do you use any walking stick?
Yeah.
79-year-old Dorene had a fall at home and injured her wrist.
Well, what I'll need to do is to put it into a gown. Yeah.
It didn't hurt at first, but afterwards I came sat here and I thought, oh, I went to lift myself. That's when I phoned my friend up, you know, a neighbour, and he came down and he phoned the ambulance for me.
You're going to go for an X-ray, all right? I just want you to tell me if you can you feel me touching your fingers?
Yeah.
You can, all right. So this is probably broken, looking at it. It's probably broken, but we do need to get an X-ray.
Break my brain, I think.
Yeah, hiya.
I was 18 when I had my first child, and I had them one after the other every year, which I only wanted one. I ended up with 10. In them days, it was a disgrace, because I was pregnant. I was 5 months pregnant when I got married. In them days, you're classed as a dirt. You know, 2 kids at her age, look. You know, and she's pregnant again. You know.
OK, so I'll just come round the other side and we'll do the plaster.
Dorene's X-ray confirms her wrist is fractured and will need to be plastered.
Well done.
Sometimes it's very hard, especially having all little ones round you, you know. I suppose if you loved someone, like I really did love my husband, you do anything for the one you love. But love turned to hate, didn't it? Oh, that's nice and warm.
Yeah, that'll feel better once that's on. Well done.
I can't sort of go into detail what was happening, you know what I mean. But I just couldn't cope anymore. So, like the 4 of my children, they went into care in Dr. Bernardo's home.
OK, now this one's a temporary one, and that's to allow for the swelling to come and go.
Oh, it was terrible. They was looking up at me and saying, Mummy, why are they taking us away? And I couldn't sort of explain to them why. I do regret it from now, you know. I used to think, why did I let them go? Why? And then I said I couldn't cope. Couldn't cope at all.
Do you receive any help from social services at all?
No.
I think you might have to accept some help for a little while.
No, I don't want to.
What about getting yourself dressed and washed and everything? Because you're only going to have the one arm.
My daughter will come up.
Does she know you're here now? No. Do you want us to call her?
Yeah.
Yeah?
Got it somewhere.
What's her name?
Helen.
Helen. OK, I'll give her a call and let her know you're here.
Got a phone call from the hospital to say that she's been in there, can I come up? Thinking, oh no, not again, what's she done this time? And she's forever tripping, nearly falling over.
Hello, Helen.
You're playing football again, earlier. My earliest memory, I was 3 years old. I was taken into Dr. Bernardo's. I remember my mum and dad walking away from me. And I remember it was me and my older sister, Diane. I remember we was hugging up so tight and crying because they was leaving us. I remember calling her and they didn't even turn round. They just carried on walking. And that was my first memory. I can remember that like it was yesterday.
Look
at me, chick. I just need to shine a light in your eye. Okay.
Dilson is waiting for the results of his CT scan. He is now calm enough to talk to police about the incident.
What's your name? That was assassinated, basically. Because what I did, I was not involved in the fight. Do you understand what I mean? Wrong place, wrong time. Exactly.
Dilson was stabbed in the early hours of the morning as he was leaving a nightclub.
Guy just came in with a knife, stabbed him behind. Then he tried to pull the knife again to stab him second time. Then I was in the car thinking, no way. So I had to do something. I said, you know what? If I don't do nothing, he's gonna die there in the front of me. Then it's gonna be something that I will never forget in my life. There's no way I'm gonna leave my friend just fighting in his own, because we came together, so we're gonna have to go down together. That's how it is. While I was trying to stop the fight, all I see, some guy came and hit me on my head. And I was thinking, oh, what the fuck? He's trying to stab me in my arm, stab me in my head. I hold the knife in the air, he hold the knife in the air, so we were like fighting. The knife slipped on my arm, and he stabbed me behind on my head. And when I feel that my head, there's a bit bleeding on my head, and I was feeling more angry, a bit agitated, and I started fighting, going crazy. I remember my jumper full of blood, but in my head, I feel like it was all sweating. I just fall down, then I was feeling shaky, and I was feeling cold and everything. And I went to the ambulance, come, and they took me to the hospital. I'm not really a fighting guy because I'm a type of person. I'm going there to have a good time. Do you know what I mean? I'm feeling like I'm very friendly with you. Do you know what I mean? I don't like police, yeah.
Well, that's fair enough.
But obviously, you got a good sense of humor because every human being got this. Not him, or he's had like a security guard. But I like you because you're different.
Thanks.
Do you know what I mean?
At the end of the day, it's only a job, isn't it?
Exactly. I like you though. I need to look after you.
Oh, scratch my back, please. Put your hand in my... No. Put your hand in there. No. If you put your hand... Go a bit left.
Yeah, I'm gonna put my hand in your bra.
That way. Right there, yeah. Oh, God.
Sydney?
Yeah.
Hiya.
Come, look, the doctor's calling you now. Here. Stop crying.
My name's Firas. I'm one of the Pediatric A&E consultants. How can I help today?
Sydney hasn't been a wee for 2 days.
Okay. No wee-wees?
No.
Has she ever done this before?
No. Okay. None of mine have done this before.
And how many have you
4.
got? Wow.
People's attitudes to teen mums are, we're young and stupid. We're not young and stupid. Some of us cope better than adults.
When me and Keely used to walk down the road with a pram, you know, older people used to look, and I say to Keely, oh look, they're looking, and Keely always said to me, don't worry, we're good parents, you know, we smile at them, this is our child, just take it one day at a time and always made the most of it.
What are you listening to?
Give me my TikTok.
What's that?
When I was younger, when I was at 13, I was most worried about not being a good dad. Because a lot of my friends, they ended up in prison or they've ended up, you know, doing bad things in their life. But it actually got me to the path where I always thought about, I've got a child. So it always kept me in the right path.
No, she's very well hydrated, aren't you?
That's what my GP said.
Yeah. When you're examining any patient, not just a child, what you do, and what I tell the medical students and the junior doctors, is just stand at the end of the bed and have a look.
It is playing detective and just getting all the clues that you can get. It's either like she's producing a lot of wee and she's desperate, or there's no wee at all, and the kidneys are packing in, and then you look ill because the kidneys are failing. My gut feeling was that she was very, very well, and I did not need to worry about her. But then I had this little niggle in the back of my head that, well, the mum's told me she's not peed for 36 hours. Parents know when their child is acting different to usual.
Ooh, what's that?
They certainly know when their child is distressed, and you've got to respect that.
What's that?
It probably is smaller than usual, so I think I would be more comfortable, and I'm sure you'd be more comfortable if we just did some blood tests, make sure the kidney function's normal.
Please. Yeah. Have that Aldi chocolate, because that man's going to stab you now.
Right. How about we watch some TV?
What's that? That's a phone.
I think probably one of the biggest changes that I've noticed in myself as a doctor since becoming a dad is the way that I probably deal with parents.
Who's that?
Very good. You can understand the pain and the hurt that they're going through, because actually seeing your child ill is the worst thing ever. It's not nice.
All done. It's all done. You gonna eat your chocolate now that's melted?
I don't think you ever stop worrying about your kids. I'm sure my mum still worries about me. I'm sure my nan still worries about my mum.
Right, it takes about an hour and a half to get these back. Is that all right?
Yes.
Cool. My mother still worries about me. She's like, you haven't phoned me today, why not? Is everything okay? Yeah, I'm fine, Mum.
I'm sorry, listen, you're doing really well. But after that, I promise, you'll feel a lot better, okay?
This is the worst bit.
Dilson's scans have revealed no serious internal damage, and doctors can now close his wounds.
Basically, I'm the miracle now, because I'm alive.
Can you sit up?
He was just trying to be the hero, but unfortunately in South London, you can't be a hero without getting a few injuries. The hero never has weapons, so always goes wrong.
Dilson is now being taken to a ward where he'll be kept under observation.
Let me take it out. God, it's all lettuce, isn't it?
79-year-old Dorene fell at home and fractured her wrist.
Ambulance driver said, you've been chasing men again. I said, it can't be a fine thing.
I went into care when I was 3, come out when I was 11. I remember saying, the girl said, oh, she's going home to her mum. So I said, well, we're going home next week, although we wasn't. Deep down, I was wishing it, but when the time actually came, I didn't like it. We passed each other and they didn't even know us, and we didn't know them. Yeah.
What is this, chicken?
It tastes like chicken.
Yeah?
I took the lettuce out of the other one.
There's only one thing I don't really understand. Why take us out knowing that 6 months later you're going to disappear? And that was my mum. She disappeared after 6 months.
I left my husband. I just had to get away. Had to get out. Because I think, because if I hadn't, I would have done myself in, you know what I mean? But it's that, it was very, very hard. Geez, now, that's the one that phoned you up.
Did I cry? Did I get upset? No. Not when she left the second time. I thought, well, I've been through this before. I took the lettuce out of it.
Now turn it down. That's quite amazing.
No, Sydney. Get a glove and blow it up. Let her play with it. Look, Daddy got. Look what Daddy got. Daddy got a balloon. Sit down then, Daddy get a balloon.
2-year-old Sydney hasn't passed urine for 2 days. Parents Keely and Michael are waiting for the results of blood tests.
Ready? You watching? Not bigger than that.
No.
Daddy's rubbish. Is this a large one?
It's medium.
I can't blow them properly, that's the problem.
Gonna pop.
Oh, wait, man, before I need emergency help. What's that?
What do you love most about being a dad?
That I can be a kid again. Like when I was riding bicycles, play with toys. Me and the children, we always go on little adventures, hide stuff around the house, play kiss chase with the children, which was pretty fun.
People's going to wonder where we are today.
Eh?
People are going to wonder where we are today.
Oh.
I've had to close the shop. I lost touch with my mum. And it wasn't until I was about 25 that I found out, it's just through somebody, I think, I found out where she was working. I was intrigued, what's she doing, what she looked like. So I just turned up there. I was scared. It took me an hour to go in. You know, I remember waiting outside. I thought, well, no, go on, you've got to do it. And I pushed myself in there. And when I saw her, I thought, oh, she looks miserable.
My purse, not my purse, I didn't brought my keys and my passport's in that pocket.
Your passport? Where you going, on holiday?
I didn't recognise her at first, you know. And I said, what do you want, love? So she said, I'm your daughter.
And then she asked me, which one are you? Yeah. I said, I'm Helen.
I can't sit in this chair, I just sit. I couldn't get over it at first. I kept having to go out and look at her and see if it was her, you know, because I said I had to get back to work, you know, behind the counter. It was only Helen that got in touch, like, found out where I was in Brixton, and she was the only one that used to come to see me. Oh, that's better.
Lean up against the back. We've been back together, we've been close for at least 25 to 30 years, that me and Mum was really, like, connected. And I've loved every minute of it because I can say, oh, this is Mum, which I've never had to say Mum before. I think I was even scared to call her Mum when I come out of the children's home, but so now I can call her Mum.
Oh, that's better.
No, Mum, move over a bit, you're hanging off the end.
Oh. Oh.
I have to forgive. Yeah. I don't know the real reason. And we all make mistakes. And that was her biggest mistake. I don't think since I've come back she's made any mistakes with me.
Swivel your bum back.
Look, there's my wrist.
Swivel your bum back.
I can't. Hang on, hang on.
I don't want to see you, Nunny.
That'll do. She'll do it.
Anything I ask her for, if it's in her power, she'd do it for me.
Oh. That's even worse.
Even if I need to talk, if I'm upset, I just call her. And she's there before I finish even the conversation. She makes me feel better in myself.
You right back?
Oh, God. I'm in the first place.
Just to say the blood test that I've just run is normal, so that's very, very encouraging. So kids that are ill, that blood test's abnormal, so it's not. So it's looking good already.
Okay. All right, thank you very much.
I don't think you can generalise about when is the right time to have a baby. I mean, I think ideally you would like to not have a baby when you're, a teenager, because I think you need a bit of life experience. But having said that, I've seen some parents come through the door at 16, 17 who are obviously loving, fantastic parents. So you can't generalise it.
You just chill, yeah? You just chill. You're causing all these problems. You're quite happy laying there.
For me, it was a natural process that at some point in my life, it would be lovely to have kids. If only so that when I'm old and decrepit, they can look after me.
We're happy. We like to have a laugh. We like to be with friends, acting stupid.
Yeah.
You have to laugh. You have to laugh. Just to forget the worries sometimes, you have to laugh.
Okay, so that's her appointment for tomorrow morning, 9 o'clock, in the fracture clinic, which is in the Golden Jubilee wing, and that's just a copy of her notes that need to come with her.
Okay.
All right.
The transport's picking me up, innit?
Booked transport.
Get decent before they come. As they've been saying, I'm chasing them in again.
All right. You take care now.
Do you think Helen knows how much you do care about her?
I don't think so. She's really gorgeous. I had my keys in my pocket, Helen. We have our quarrels, admitted. We have our quarrels sometimes. But she's my life. My Helen is my life. I really love my Helen. She was there for me. And she really, Sorry. I mean, yeah, no, that ain't it. What's the way out? The past is the past. Some of it's really sad. That's why we don't talk about it. We don't talk. We only think of today. What goes on today? What goes on tomorrow? Look forward to the future. That's what I always say.
We are definitely not having any more children. We don't need any more. We haven't got the space, or the money, or the time. No. I think if Chelsea was to have a baby, I would go mad. It's not what I want for her. So she says she hates kids anyway. So maybe she won't bother.
God gave me a second life, so obviously I always have to be there for my daughter. I want my daughter to be proud of me. I got a good dad.
I'm young to myself. I don't feel 79. You know, I can go out there, I play with the children out there, because people say to Helen, ain't your mum energetic for her age? I say, well, no use sitting moping about, just get on with it, and I do. That's it. I go down doing a bit of raving if I was to go up there.
But you're going to shake a leg.
Thank you.